Bleeding and wound care. Bleeding can be a major or minor emergency. When you discover a child bleeding, follow these steps. First, put on medical exam gloves or improvise protection from contact with the person's blood if no gloves are available. Move aside any clothing and place a sterile dressing or clean cloth over the wound. Apply firm pressure directly over the wound for about 5 minutes to stop the bleeding. Reevaluate the bleeding. If the dressing becomes soaked with blood, don't remove it. Add more gauze and keep applying pressure. If needed, wrap a bandage around the dressing to maintain direct pressure on the wound to control bleeding. Wrap toward the body. You will know that pressure is sufficient if the bandage is snug, but a finger can be slipped under it. Here's how to apply a pressure bandage. First, anchor the end of the bandage. Roll it around the limb toward the body, leaving an overlap with each turn. Fasten the other end securely. Be careful not to wrap the bandage too tightly. If you can slip your finger easily under the snug bandage, it is just right. If the wound is severe, treat the child for shock and call 911. Minor wounds. If the wound is minor, it can be cleaned to prevent infection and promote healing. Gently wash shallow wounds and abrasions with lots of warm or room temperature water, with or without soap, to remove dirt. Do not use alcohol, hydrogen peroxide, or iodine on a wound. Pat the area dry. Apply antibiotic ointment to an abrasion or a superficial wound if you know the child is not allergic to it. Then cover with a sterile dressing and bandage. Deep wounds. For a deep wound, let water run over the wound to remove any foreign matter. Then cover it with a sterile dressing and bandage. Nosebleeds. Nosebleeds can be alarming. They often appear suddenly, even without trauma to the nose, and seem to produce heavy bleeding. When a child has a nosebleed, have him sit and tilt his head slightly forward with his mouth open. Check his nostrils for any object and remove it. Pinch the child's nose just below the bridge and hold for 10 minutes. Do not place any objects up the nose. An older child can do this for himself. Tell him to breathe through his mouth and not to speak, swallow, cough, or sniff. After 10 minutes, check to see if bleeding has stopped. Pinch and hold for another 10 minutes if it hasn't. If the child is gasping or choking on blood, call 911. Also call if the bleeding hasn't stopped after 2 rounds of pinching, you suspect his nose is broken, or if the child is known to have a bleeding disorder.